Hi, I'm Laura Rathbone. I'm a consultant in psychologically informed physiotherapy for complex and chronic pain, an advanced practice physiotherapist, and a manual therapist. I'm very happy to share that I'm now accepting new referrals for my in-person clinic in Utrecht, and soon we'll be opening a second location in Weesp. And I'm accepting referrals from all over the Netherlands. So if you're able to travel to me, that is absolutely wonderful. If you're not able to travel, but you still feel that you would like to work with me and collaborate with me on managing and understanding and treating your pain, then we can do that through virtual consultations. And I like to be able to offer both virtual and in-person sessions because travel is not always necessary and can be inaccessible for people who are experiencing complex pain, as it can often lead to increased experiences of pain just from the travel alone. And the treatments and the therapies and the approaches are also an extra load. And so, what can happen when people have to travel long distances is they can see a significant increase in their pain that's just from trying to get to a clinic. So, if you would like to work with me but travel is not possible, or perhaps you're living outside of the Netherlands and you would like to work with me through a coaching model, then we can do that through a virtual experience. I've been delivering virtual care now for about 6 years. So even before Corona meant that we all had to shift across. And I've been delivering virtual care because not only does it create accessible ways for people who find travel difficult, but it also means that we don't always sit in my space, in my clinic space. It means that I can be more embedded within your space because your laptop or your phone can go anywhere with you. And so I have been to people's gyms, I've been to people's houses, I've been to people's favorite walks in the forest around the corner, I've been on the beach with someone, and even into the stables. So whatever it is that whichever is the goal that we're working towards, whatever activity is really important to you that you're missing out on at the moment, virtual care actually gives us a lot of space to start working more embedded within that. So I really like the flexibility and the creativity that it offers. It really isn't just a sort of second best option. It actually comes with a lot of creative freedom that people, patients and clients often find they had never really thought of before. So if virtual care isn't something that you've done before, or perhaps it's something that you've thought wouldn't be good enough for you, but you would like to work with me, you would like to try it, then please do get in touch because I'd love to talk you through how virtual care can be a significant and an important part of your therapeutic process. In my practice, I am an advanced practice physiotherapist, which means I have a master's from, my master's is from King's College in London, and that was in advanced neuromusculoskeletal physiotherapy. This qualifies me to be a manual therapist in the Netherlands, although I don't use manual therapy in what is the culturally normal way in the Netherlands. Advanced practice physiotherapy is much more about clinical reasoning and thinking critically about when to touch a person's body and when touch is an important part of the therapeutic process. And also, there's a lot of conversations happening now about whether the manual therapy approach is as specific as we thought it was. What we're finding from the evidence is that it's probably a lot less specific. And any kind of touch has the opportunity to bring about change, but also negative effects. And so, when we're working with someone with complex and chronic pain, we need to be aware that it's not always so easy to predict what the experience of that person is going to be like. And so, as an advanced practice physiotherapist, I take a lot more time in making those decisions, and really making sure that the decision is never just mine in isolation. It really needs to be something that we collaborate on. So for me, the therapeutic space is much more about shared decision making and a collaboration, because actually the evidence tells us that almost anything has the opportunity to bring about change, which means that when we make the decision, we really want to make sure that it's personalized and that we can optimize it so that you have the best possible chance for a positive outcome, which is what this is all about. I so I integrate manual therapists, but I also think about pain much more than just from a biomechanical perspective. Yes, posture is important, and yes, tissues and tissue damage is important, and changes that we see on scans, or the lack of changes that we see on scans, is also important. But we're really coming to understand pain much more from a perspective of the neuroinflammatory system, the neuroimmune system. And that means that we're thinking about the brain, we're thinking about the spinal cord, and we're thinking about peripheral nerves in the same way that perhaps a neurophysiotherapist might be. So, somebody that works with people who have had neurological conditions, although pain and neurological conditions are different. Often they come together though. So, when we're conceptualizing and understanding a person's pain, it's so important that we can also add to the story through the position of the physiology, the neurophysiology. And so, what you might find when you work with me is that you hear a lot about the biology, and we can enter into what's called pain neuroscience education, which is where I help you to know the kind of stuff about pain that we know from the research. And we can go as deep into that or as shallow into that as is useful for you. It's absolutely not required that every person with pain knows all about their nerves and all about the areas of their brain. If it's interesting to you and it helps you to make sense of your pain, then we want to be able to expand that part of the therapy as much as possible, which is why I invest in making sure that I understand the biology and how it connects to the pain experience as much as I can. Another way that I integrate into my therapy is something called acceptance and commitment therapy. And this is a third wave CBT, which means that we focus much more on present moment awareness and compassion. And rather than trying to change the experiences, we turn towards acceptance and a willingness to allow them to be alongside us. So we're not pushing things away, we're allowing them to be there and seeing what kind of transformation that can bring to the experience in general. It's an evidence-based CBT and is recommended in many of the guidelines produced by the country's healthcare regulatory bodies, including the UK and the Netherlands, and has shown to be really helpful for people navigating the often complicated, complex, uncertain, and unpredictable experience of chronic pain. It's less about trying to make the pain go away before life begins, and more about acknowledging that it may be that moving towards the things that are important are a big part of helping pain to reduce. And so rather than waiting, we're going to take a more pragmatic approach and start exploring. Pain therapy has come on leaps and bounds, but we still have a huge way to go. That's why it's important that as a physiotherapist and as a pain specialist, I am comfortable with taking a mixed methods approach. It may well be that you are using pharmacological approaches like medicines, intervention approaches like neuromodulation or injection therapy. And it may well be that you have multiple other therapists on your team. And I am absolutely comfortable working alongside those therapists. If they are on your team and they're helpful for you, then we would not want to change that. We do have a long way to go in terms of pain therapy, but pain rehab and pain and non-interventional conservative approaches have come on a really long way in the last 10 to 15 years, particularly with our understanding of things like the consciousness and perception. So a modern pain specialist therapist would start to introduce things like virtual reality, mirror box therapy, graded motor imagery, art, creativity, expression, narrative, alongside more traditional methods like touch and exercise. Because what we understand is that pain is an experience of the human, and the experience is built up of context, its meaning, as well as what's happening within our biology, as well as what's happening within our lives. And so I will support you by weaving together all of these different approaches as we focus on what is important to you and what is the next best step for you in your therapeutic trajectory. If you'd like to work with me, or you'd like some more information, or just to set up a free discovery chat, just to have a meeting with me and see whether you get a good feel or a good vibe, please reach out and send me an email. Voor people within the Netherlands, ik kan wel Nederlands praten en ik kan wel Nederlands verstaan. Soms is het belangrijk dat ik kan een beetje Engels praten, omdat ik heb niet zoveel Nederlands als jou, omdat ik ben heel nieuw in Nederlands praten. Maar we kunnen altijd een oplossing vinden. En dat is belangrijk. Jij hebt echt een recht om jouw zorg in jouw moedertaal te hebben. En ik kan en ik zal mijn best doen om dat recht te houden. So if you would like to get in touch, do please send me an email. I'm also accepting referrals. This is a tertiary clinic. So whilst it is possible to set up a care with me yourself, I also accept referrals from medics and other clinicians who are working with people who are experiencing complex and chronic pain. So if you have a patient on your roster right now who hasn't accessed specialized care for their pain condition, and their experience of pain doesn't seem to be responding to traditional methods, it may well be time to start thinking about a tertiary referral, which is a specialized clinician outside of the general system, which is exactly where I sit. So the contact details are all on my website, and I hope to hear from some of you very soon.